So hello everybody. Wanted to do a follow-up video on homework number 3 for treatment planning. You guys did pretty well on this assignment. I just wanted to point out a couple of things. So on case number 1 actually went well. There weren't any problems with case number 1. You were able to find all of the factors that you needed for this SSD scenario with no blocks. And then case number 2 was similar. Same SSD technique, same energy, different field size, no blocks. So this went over pretty well. I just wanted to go over the summary question where I asked, what's the difference between case number 1 and case number 2? Case number 1 had a smaller field size than case number 2. Neither one had blocking. Both of them were the same energy, so the energy didn't change. The depth of treatment was the same, and the prescription was even the same. So why were the treatment times different? Well, most of you gave the correct explanation in that when you open the field size, there's more scatter contribution to the reference dose rate. So with more scatter contribution, that actually increases the dose rate. So to give the same amount of dose, you need less time. The other thing is, you may notice when you look in the percentage depth dose table that as the field size increases, the percentage depth dose also increases. And the reason the percentage depth dose increases is because of the greater scatter contribution. So in case number 3, we kept the same field size as case number 2, the 15 by 15, but this time we used blocks and we blocked the field down. So I had explained earlier how this was really important in this situation because the field is blocked down. That indeed changes the scatter. We can get really complicated and talk about SAR values and Clarkson's method, which I think we talked about a little bit before we went on quarantine. But in this situation, I wanted you to realize that since we have a collimator setting different than the actual treatment setting, we need to account for those differences by using the scatter factor for the collimator setting, and then the phantom scatter would come actually from the effective field size. The effective field size was actually the 8 by 12, so you needed to find the equivalent square for both field sizes. The equivalent square for 15 is already square. The equivalent square for 8 by 12 is 9.6. And then, so I was saying you need to find the collimator scatter for the collimator setting, and then the phantom scatter for the effective field size or the treated field size. The percentage depth dose actually should come from the treated field size. When you looked up the percentage depth dose factor, we really should use the treated field size to get this factor. And then we also had a transmission factor because we used a plastic tray, shadow tray. But the one thing that I left out, and I'm not sure that came through the readings, it appeared that it didn't, is that we still need the backscatter factor. I think I remember Kristen asking this question. We still need backscatter factor. But in this situation, since we have a collimator setting and a treatment setting, which is different by blocking, we actually need both backscatter factors. So we need to look at the backscatter factor for the collimator setting and find the backscatter factor for the treated field area, and then actually set up a ratio. So we're going to put the backscatter factor of the effective field size over the backscatter factor of the collimator size, and that will give us our new backscatter factor right here. So even though we didn't do this, most of you did not do this, and you probably used the collimator setting for the percentage depth dose, the value that you came out with treatment time was very close to this. It didn't make a whole lot of difference, but I just wanted to explain that that's the way we should account for those changes when we're doing manual calculations. Now again, our computers do all of this for us, but this is what the formula should have looked like for case number 3. The reference dose rate, the collimator scatter for the 15 by 15, the phantom scatter for the 8 by 12, the percentage depth dose for the 8 by 12 at the treatment depth, which was 5, and then backscatter factor should have been in ratio. We put those in ratio, we get a backscatter factor of 0.98, and then the trade factor, and this is about the treatment time. So the treatment time is a little bit larger than the previous case number 2. One thing is we have a tray, we have an absorber there So that changes things. The other thing is that we've blocked down the field size so we don't have as much scatter contribution. So those two things together combined actually would make the treatment time different. So the moral of the story is whenever there's a change to the treatment plan, the treatment plan will consider all of these factors: the depth of prescription, the field size setting on the MLC, the shape of the field, the percentage depth dose if we're doing SSD. All of those factors will be considered in the calculated treatment time by the computer. But if by chance during the patient's treatment regimen, the physician wants to make a change, like change the field size, or add a block, or the patient loses weight, and the depth should even change, I want you to know that the treatment time would also have to change, because then the reference dose rate changes. Okay, so that's the review for homework number 3. Good job. I'm going to do another video, and we're going to go over homework 3A. We're going to do a preview before you work on that assignment. Okay.